Hello everyone, I am Dr. Monisha. I am working as a senior resident in the Department of Psychiatry in Sree Balaji Medical College Hospitals. So today my topic would be covering about stress. As we all know that stress is a day-to-day phenomenon present in all our lives, and it is a very common term which is used very carelessly. But today we are going to demystify stress, and we are going to talk about what exactly is stress and what are the causes of stress, also about how to deal with stress in a proper fashion. Stress is an internal state which can be caused by physical demands on the body, and they can be disease conditions, exercise, extremities of temperature, or by environmental and social situations which are evaluated as potentially harmful, uncontrollable, or exceeding our resources for coping. So, what is stress? Once induced by stressors, the internal stress state can then lead to various responses. On one hand, it can be physical like bodily responses. On the other hand, psychological responses like anxiety, hopelessness, depression, irritability, and a general feeling of not being able to cope with the world can be present. So, when a person is stressed, usually they make two kinds of judgments. First, they must feel threatened by the situation. Then, they are judging whether their capabilities and resources are sufficient enough to meet the threat. When there is a mismatch between these two conditions, a person undergoes stress. Now, coming to the causes of stress. There are various kinds of stress present in our day-to-day lives. First one being commonly seen in working individuals are the way the employees or students are treated by their teachers or their employers. The other causes of stress are the rules or the policies. Suppose if the rules are very stringent and it doesn't give way to any freedom, this causes stress in the individual. And at the policy level also, sometimes the individual might undergo stress. Now coming on to the expectations, being unclear expectations. This is commonly seen with our OP patients, wherein wherein the couple comes with expectations being unmet. One partner has a certain set of expectations which are not being clearly verbally explained to the other partner, and this leads on to conflict, and subsequently it leads on to depression and further serious mental illnesses. Now, with the urgent deadlines with projects, that is very commonly seen in all employed individuals. We often tend to procrastinate till the last moment and then we end up stressing ourselves. And also when there is too much work, especially when one of our colleagues have taken leave because of their personal work, or there is understaffed employees, that time only one of the person has taken the responsibility of work. That time that person might undergo a lot of stress. And this too much work not only applies to the work environment, it also applies to the home environment, wherein the homemakers especially have to take the burden of the looking after the family and doing the household chores. Even they are undergoing a lot of stress. Again, next being relationship conflicts. Yes, a part of it I had explained it in the unclear expectations, but the other part of relationship conflicts include there is some personality issues with the couple, and one partner is unable to understand the other partner, or else one partner is not giving adequate time for the relationship. This all can be a source of stress. Next, coming on to peer conflicts. In peer conflicts, one can be that of seen in students while they are studying, or even with working individuals in their working environment. The third one can be even the sibling conflicts. In students, usually what happens is there's a lot of comparison seen at the college level, and wherein the students themselves try to compare themselves with their peers, and leading unnecessarily to stress. This comparison could be in terms of looks, academic wise, and otherwise also in terms of social status. The same thing applies for the conflicts with within the employees, wherein there is a conflict for promotion, or a conflict for hike in salary, or a conflict in terms of being favored by their employer. All this can lead to stress. Now, focusing on the causes of stress in students. First one being the academic stress. When an individual is having a huge syllabus to cover, that is a very common cause of stress in students, especially when they have not prepared adequately throughout their academic year and it has been postponed till the last minute and they have a very huge syllabus to cover. Second, being frequent exams. That is a very common cause of stress, especially seen in school-going students. There are a lot of exams being kept for them and there is no time for them to process about their difficulties and reflect back. Next being more assignments. The same thing goes wherein the students are engaged most of the time in the assignments and not have much time to prepare for their exams. The last one is their responsibilities. Being a student, their responsibility is not restricted only to studies. They have other responsibility as well, especially if they are involved in curricular activities and also have taken up some leadership roles. Those kind of responsibilities will also add on to the stress. Now, coming to the social or physical cause of stress. First one being inadequate hostel facilities. When a student has lived his or her life throughout home, being in the home, their facility is totally different when they come and start living in a hostel. So there is always a mismatch in the hostel facilities, which can cause a stress to the student. Next one being insomnia. After being in a very structured environment at home, now they are being exposed to a lot of freedom, and they have a lot of time with their hands. So most of their time and energy goes in unnecessary things, including social media, which leads on to poor sleep hygiene and leading on to sleeplessness. Next point being the interpersonal relationships. Especially in a student life, the interpersonal relationship takes a major spotlight in their life, and their major relationships are mostly friends and family. And when they have come to a new environment, forming relationships in the early stage will be difficult, and there are bound to be a lot of interpersonal issues with their friends. So this will be a major cause of stress in that individual. Language being another cause, especially seen in students who have relocated from the other parts of the country, and it's very difficult for them to learn a new language, adapt to a new kind of lifestyle here, and to get along with the other peers. Next being discrimination. Discrimination can be at the level of looks, as well as at the level of academics, or at the level of social status. So discrimination is also a very important cause of stress in students. Last but not the least is the financial stressors. If a person is from not a well-to-do background and they are suffering from other financial stressors at home, it will definitely cause an effect on the student. Coming to the physical signs and symptoms of stress, how will it manifest? Or how do we know that we are having stress and we are stressed out? So these are a few signs and symptoms which one can be mindful of. They are increased heart rate, having elevated blood pressure, and at times they can present with tightness of chest. Or the least common ones being breathing difficulty. Suddenly that individual might be doing their day-to-day activity and suddenly they might have breathing difficulties. They might also present with migraine and fatigue. And fatigue meaning that they are tired without any specific reason. And they, even in spite of adequate rest, they are found to be very tired. And most of the time they are very restless. That is, they find it's difficult for them to relax, unwind after a whole day. Other symptoms include backache, and most common ones will be the gastrointestinal symptoms. They present with usually at times with indigestion, also burning sensation in their upper abdomen, with nausea and vomiting. At times they can present with constipation or also diarrhea. Some people present with weight loss, or some people go in to use food as their coping mechanism, which leads on to weight gain. Coming on to the psychological signs and symptoms, the individual will be seen to be very irritable, and they are very hypersensitive, being that even a normal joke which usually the individual takes it up in a very light manner, we find them to be very sensitive to it. And also anger outbursts. We see the individual can be seen to get angry without any reason, and at times there might be even physical aggression. The other signs include jealousiness. This is because they are constantly comparing themselves with their peers. And hostility. Even when someone tries to help them out, they become very hostile to them. Hostile meaning being very rude or unkind. They end up blaming others for their stress. They end up saying that so and so is the reason for me to feel very stressed. At times, they might be suspicious. The other symptoms include lack of interest in previously pleasurable activities. Suppose an individual likes to draw or paint or likes to read books. Now they don't want to do all these things, and they would prefer to be withdrawn, and they don't want to interact with the outside world. They are mostly involved within their own world. That is their reduced personal involvement with others, and they are found to be crying frequently. Without any reason, they find themselves to be crying. And lastly, they adopt a negative attitude. The negative attitude might be towards themselves, feeling that they are very worthless, or it can be towards the world, feeling that the world is hopeless, and also that they feel that nobody can help them in their situation. They kind of develop a cynicism towards life. Now, regarding the symptoms, these are a bit further worsening of the earlier mentioned symptoms. They are found to be very forgetful. And even if initially they'll be able to do all their day-to-day activities or responsibilities with ease, but currently they'll be forgetting them, and their attention and concentration will be impaired. They're always found to be very preoccupied with all the stressors, and most of the time they'll be in their own fantasy life, not wanting to interact with others. Yes, I had mentioned already about the decreased concentration. Next, there will be a slowing in their thinking process, and their reactions will be very slow. They'll not be reacting appropriately, and they find themselves to be using a lot of time in learning subjects, when earlier they used to learn it at a very fast rate. Also, that they find themselves to be doing their day-to-day activities taking a lot time, and their performance will be not par to their earlier performance, and their marks will also not be at a good range. Another thing which I have not mentioned here is regarding the social media usage. That is also one of the signs wherein a person spends a lot of time on social media, scrolling through the app mindlessly and trying to distract themselves from what they are exactly feeling. At times, they can present with the severe form of stress or burnout being depression. In depression, they have pervasive, persistent low mood, also at times having anxiety, and at times being irritable. They have decreased interest in pleasurable and routine activities, have decreased energy in doing their day-to-day activities. At times they might have increased sleep, but most of the time they have decreased sleep. Sometimes they tend to cope up by excessive eating, which presents with increased appetite. or most of the time they present with decreased appetite with weight changes accordingly. They again have decreased concentration, indecisiveness and forgetfulness. There are pessimistic thoughts about their future being hopeless, and about the self being worthless, and about the environment also. The more worse scenario is being having suicidal thoughts, which at times lead on to actions. So, how do we handle and manage stress? Stress can be managed at 3 levels: the primary level, secondary and tertiary levels. Primary level being at the organization level. So what can be done? The work can be organized in a better way, in a better structure, and clear roles and responsibilities can be allotted. Also, to keep in mind of the demands which are being placed on the employees or students, to provide adequate support to them when they have a burnout. Also to encourage change in responsibilities if a person is suffering from burnout. To improvise on the work climate, being very inclusive and having supportive managers will come a long way. Also, to improvise on the work culture, focusing more on having a happy and satisfied work culture rather than being very work oriented and leading on to a lot of stress. At the secondary level, it is at the person level. What can the individual do to prevent and manage stress? They can undergo counseling with their psychologists or counselors. If they find themselves having difficulty in relaxation, they can undergo training in relaxation. Also, if their resilience is on the lower side, can undergo resilience training. If they find themselves running out of time, can improvise on their time management skills, and also to undergo stress management training. All this can be done to the person as a preventive measure to handle stress. The last one being the tertiary level at the person themselves. It's if they find themselves too overwhelmed and having difficulty in handling stress, it's always better to approach a mental health professional and to take treatment or therapy. And while this treatment or therapy is going on, if they find themselves not having difficulty in handling their day-to-day work, they can take leave from their work, or a change in environment is better, and they can undergo rehabilitation and then get back to work. So we have spoken about the handling stress at the primary level, the secondary level, as well as the tertiary level. Now coming on to the coping strategies. These are the coping strategies which are commonly used by individuals. One is undergoing relaxation techniques, going for exercises, yoga, listening to soothing music, employing distraction meaning positive distraction, like talking to a friend or a family member, reaching out to a long lost friend, or engaging themselves in a newfound hobby. Last one being meditation. Relaxation is not compatible with the kinds of bodily activity involved in fear and anxiety. We cannot be both relaxed and anxious at the same time. Thus, the fear and anxiety weaken if the client remains relaxed. This is based on reciprocal inhibition. They can also do JPMR, that is Jacobson's progressive muscular relaxation, also cue controlled relaxation. Coming to time management, to-do lists are prioritized lists of all the tasks that you need to carry out. They list everything that you have to do, with the most important tasks at the top of the list and the least important tasks at the bottom. All the things to do must be noted together. When used effectively, you'll be much better organized and you'll be much more reliable. You'll experience less stress, safe in the knowledge that you haven't forgotten anything important. Moreover, if you prioritize intelligently, you'll focus your time and energy on high-value activities, which means you are more productive and more valuable to your team. The other important skill is problem solving. It includes the ability to deal with unexpected difficult situations, also to assess the situations and to appropriately identify solutions for them. Coming to cognitive therapy, the thought awareness helps you to identify the negative thinking like fear of failure, unwanted criticism, unpleasant memories, and misinterpretation of situations that may interfere with your performance and damage your self-confidence. Rational thinking helps you to challenge these negative thoughts like feelings of inadequacy, worrying about performance, situations outside one's control, worrying about others' reaction, and either learn from them or refute from them as incorrect. You can use positive thinking to create positive affirmations. I have prepared adequately. I won't bother about others' unfair criticism. And that you can use to counter negative thoughts. These affirmations neutralize negative thoughts and build your self-confidence. Coming to counseling, and these are the steps which are involved in counseling. Empathetic listening with supportive psychotherapy, listening attentively, allowing the person to ventilate, also to carry out the assessment of risk if required, to do crisis intervention, also to seek further help from the family members or other mental health professionals. Counseling is also involved, can be given in telephonic services. So throughout the presentation, we had looked about what is stress, the causes of stress, and how to handle stress. So we must remember that anything which overwhelms the physical, emotional, and social resources of a person can lead to stress, and this can be internal, social, and environmental stresses. And we should remember the signs and symptoms of stress and stress-related disorders so that we can effectively change our coping strategies and accordingly lead a healthy and productive life.